Yeah, so welcome to part two of the video. Remember, we were talking about cancer. We spoke about what is cancer, how it happens, and then we spoke about the risk factors. Those some that you can prevent, some you can't. And we mentioned a number of risk factors, including smoking or tobacco use. We spoke about alcohol, excessive alcohol consumption. Spoke about obesity or overweight. Spoke about environmental pollution or environmental carcinogens, and we also spoke about the causes actually of cancer, and mentioned a few chemicals that may cause cancer. Something I did not mention is that we also have some um, um, risk factors which we don't have control over. For example, the more you get old, the more the risk that you will suffer from cancer. Family history is another risk factor. Those are risk factors which you don't have control over. So, how do you prevent cancer? So, the way to prevent cancer is to prevent exposure to risk factors which we can prevent. And one of them is stop smoking, reduce alcohol intake, or stop alcohol intake. You need to do exercise, at least 30 minutes every day. That is uh, better aerobics. So you need to maintain a healthy weight. You need to foster going for good diet, nutritional diet that includes fruits, vegetables. Um, Avoid processed foods, for example, avoid unsafe, unhealthy fats. Um, you know, early screening is very important because there is a stage zero of cancer, whereby if you are found within that stage zero, where we have just some early signs of mutation or change in the normality of cells, and then it may also be taken care of before it becomes malignant. Then, of course, immunizations. We have other immunization for certain risk factors. Maybe I did not mention them, but with viral diseases, some viral diseases have been implicated to cancer. Of importance is human papilloma virus for cervical cancer, and then we have hepatitis A, B, C, D viruses for hepatitis or hepatoma, liver cancer. We also have others. Um, Other viruses, actually, like HIV, which also has been implicated to cervical cancer. So there's immunization for some of these viruses, like hepatitis B, hepatitis C. We have immunization for that. And how is cancer diagnosed? Cancer is diagnosed through a number of ways. So we have um, tests that pick tissues, and the tissues are taken to the lab and they are assessed for abnormal cells, and that's what we call a biopsy. So you can get a biopsy, or a needle can be used to extract a tissue from a tumor, and that is taken to the lab for analysis. Two things can be done commonly. We have cytology, where the tissues, the cells, the individual cells are assessed, but we also have where we assess, the whole tissue. We assess the tissue to see structurally, and if it is cancerous or not cancerous, what we call histopathology or histology. We also, there are many other tests whereby X-rays can show early signs of cancer. For example, bone. You have CT scan. You have MRI, magnetic resonance imaging. You have so many other tests that can be used to confirm if there is cancer or not. For breast, we have, for example, mammogram. Internally, there is a lot of other procedures you can do. There are gadgets which you can be used, taken inside the body, and they are used to basically do a visual inspection, as well as even to collect tissues to the lab for cancer testing. So, management of cancer is in four ways: radiotherapy, whereby the cancerous cells are killed by the radiation, what we call radiation therapy or radiotherapy. Then we have the use of chemotherapy, where certain drugs that can kill cancer cells are used. And then we have another form where surgery can be done, or a combination of those three commonly. But you also have palliation, where it's more of supportive treatment and requires a lot of counseling, nutrition,